burning, tingling, or numbness down one arm. That's often a pinched nerve in your neck, cervical radiculopathy. It happens when a nerve root in your neck gets compressed, like a kink in a garden hose. Causes include herniated discs, bone spurs, or even poor posture. The good news: most cases can be managed at home with the right steps, no surgery needed. Let's dive into what you can do right now to start feeling better. First, stop the activities that trigger your pain. This is smart rest. Don't just lie in bed. Avoid movements that send pain down your arm, but keep moving gently. Light walking keeps blood flowing and helps healing. Take a break from heavy chores and be mindful of your neck position for a couple of days. This short rest period calms inflammation and sets the stage for recovery. Remember, you're not being lazy. You're giving your body a chance to heal. Now, let's talk about managing the pain. For sharp, recent pain, use ice to reduce inflammation, 10 to 15 minutes at a time. For muscle tightness or stiffness, heat works better, 15 to 20 minutes with a heating pad or warm towel. Alternate ice and heat if both help. Always use a barrier between your skin and the pack. Listen to your body and use what feels best. Next, let's cover pain relief options if you need extra help. If pain is stopping you from moving, short-term use of over-the-counter meds can help. NSAIDs like ibuprofen or naproxen reduce inflammation. Acetaminophen relieves pain. Use only as directed and check with your doctor if you have health conditions. The goal is to ease pain enough to start gentle rehab, not to mask symptoms and overdo it. Now let's get moving with gentle stretches. Once pain eases, start gentle stretches to relieve pressure on the nerve. Try chin tucks. Glide your head straight back. Hold for a few seconds. Repeat several times. Upper trapezius stretch. Gently tilt your ear toward your shoulder. Hold and switch sides. Levata scapulae stretch. Turn your head toward your armpit and nod down gently. Hold each stretch for 20 to 30 seconds. Never push through sharp pain. Stop if you feel a zinger. These stretches help restore space and mobility. Next, we'll mobilize the nerve itself. Neural gliding or nerve flossing helps the nerve move freely and reduces sensitivity. Extend your affected arm out, palm up, and gently bend your wrist back. Tilt your head away as you relax your wrist, then return your head and bend your wrist again. Repeat this slow, gentle motion 5 to 10 times. Stay within a pain-free range, no sharp sensations. This technique can make a big difference in nerve pain. Now, let's fix the habits that cause the problem. Poor posture, especially tech neck, is a major cause of pinched nerves. Adjust your screen so the top third is at eye level. Use a stand or books if needed. Use an external keyboard and mouse for laptops. Support your lower back, keep feet flat, and relax your shoulders. Take breaks every 30 to 45 minutes to move and reset your posture. Bring your phone up to eye level instead of looking down. These small changes prevent recurrence. Once pain is down, it's time to build strength. Strengthen neck and shoulder muscles to prevent future problems. Start with isometric exercises. Chin tucks with gentle resistance, side bending, and rotation. Progress to scapular squeezes. Pull shoulder blades back and down. Hold and relax. Avoid shrugging your shoulders. A physical therapist can tailor a program for you. Let's wrap up with your action plan. Here's your 7-step plan. Smart rest, ice or heat OTC meds if needed. Gentle stretches, nerve glides, fix your posture and strengthen. Most people improve with these steps. Be patient and consistent. If pain is severe, constant, or you have weakness or coordination issues, see a clinician. Recap. Rest smart. Relieve symptoms, stretch, glide, fix posture, and strengthen. Like, subscribe, and comment your favorite stretch below. Your feedback helps others and shapes future videos. Stay active, stay informed, and see you next time.